again, washing my hands and coming into the room, introducing myself, all those things. So hi, my name is Jocelyn. I'm your nurse today, and I'm here to do a neurological assessment on you. So I'm going to ask you some questions and take a look at your nerves and muscles, have you make faces for me, things like that. Can you tell me your name and date of birth?
1 August 3rd, 1988.
And double check her wristband, and that looks good. Anyhow, so can you tell me where you're at today, Manny?
At the hospital.
Okay, which hospital?
The VA hospital.
Okay, all right, that's good. Do you know what day it is, or the date?
It is September 19th, 2012.
Good. So she's pretty oriented to person, place, time. If she was not sure about date or time, then I might ask her, do you know who the president is? Do you know what time of year it is? If I was really concerned that she was like, I think I'm in a hospital, then I might ask her, do you know why you're here? Again, you can go down a little further if you need more information. So I'm going to ask you a few questions about your health history. Do you have any issues or history of migraines or headaches?
No.
Okay. Have you ever had a stroke or a seizure? No? Okay. How about your joints? Do you have any arthritis or osteoporosis or anything like that that affects your joints? Okay. If they do have arthritis, again, which a lot of our older patients have, we want to ask where it's at, if there's any pain, because when we're doing our assessment, we don't want to, make it worse for them. Okay, so I've assessed her. She's A&O times 3. She's alert and oriented. I got her history from her, so now I'm going to go into my cranial nerve assessment. So the first thing I'm going to do is look at your eyes and how they work. So I'm going to check your optic nerve. I'm going to have you take a look at this little sign here, first covering one eye and then the other, just like at the eye doctor, and tell me what you can see. Again, this is very non-specific. I'm not going to tell her she needs glasses. I'm just looking to see that things look okay. So which is the lowest line you can read?
LTFPH.
Okay, let's try the other eye.
LTFPH.
And together, both eyes?
LTFPH.
Now cover both? No, I'm just kidding. All right, so she's got good vision. That's working okay. I'm going to go ahead and check her sense of smell. So I'm going to have you close your eyes and tell me what you smell. Okay. Not the kind you drink. Like I said, you can also put a little sanitizer on your hands and see if they can smell that. Now I'm going to go ahead and look at your pupils. So I'm going to shine a light in your eyes. I want you to just kind of look over here at my ear. And you give them a non-specific place so they're not staring you right in the eye while you do it. And I'm going to watch your pupils and see if they dilate. Oh, they both constricted together. And they both constricted together. So she's got good pupils are equal to light. They're round. They're reactive. And now I'm going to just have you look at the end of this pen light and follow it in as I bring it towards your face. I'm watching that her eyes are crossing together, and I might notice a little bit of pupil constriction. So she's also, their pupils are equal, reactive, round to light, and accommodation. So she passed that one. Now I'm going to look at the movement of your eyes. I'm going to have you take a look at this pen at the end of the pen and just follow it with your eyes and not with your head. Okay? So see how I'm kind of like I'm far enough in front of her that she can see it, and also going far enough away that I can really see the motion of her eyes, kind of pushing them to the extreme there. More. Good. And I don't see any nystagmus or any abnormalities with that. Now I move on to the facial nerves. Kind of, again, we group them together. This checklist has us doing 5 and 7 together. And I will sometimes just put hearing and spinal aside and just get all that facial nerve stuff kind of done at once. The first thing I'm going to have you do is raise your eyebrows, stick out your tongue, move it side to side. Okay? Show me your teeth. Puff out your cheeks. Make a frowny face. Okay. All right, so I got the facial, I got the actually snuck in the hypoglossal there too. I'll have her close her eyes, and I'm just going to feel, I'm going to touch your face, and you tell me where you feel it, okay? Okay. What side?
Sorry, right cheek.
Okay.
Left chin.
Okay.
Right chin.
Okay.
Left cheek.
Okay.
And right forehead.
So she's got the sensory aspect of that trigeminal nerve working for her. And then I might go ahead and just, when I had her open her mouth, I could also have her do it again. Open up, say ah. I'm just looking to see that her uvula rises. You can give me a little dry swallow. See that everything's kind of working there. So I kind of got number 10, number 12, and number 14 done kind of all together. Just sufficient. But you can do it whatever way you want. If you like to memorize things orderly, it's fine. Now you close your eyes and tell me what side you hear a sound. Okay?
On the right side.
And again, if she had hearing aids or something, I probably just might ask her some questions about that. And also, if she had glasses, she can wear them for this part. but then I would take them off so I can look at her pupils better. And then finally, we're gonna do your spinal accessory nerve. So I'm just gonna have you shrug your shoulders against my hands. Good, all right, and turn your head towards my hand. Turn it again. All right, so that was a good cranial nerve assessment. Everything was within normal. Now I'm gonna move to her neuromuscular, again, beginning by just looking at a general survey of her overall posture looks normal. Her muscles don't look wasted or abnormally sized. No limb is shorter than another. There's no feet missing or anything interesting like that. Everything looks good there. And I'm going to start with her upper body. And I can, palpate down along her muscles, and they all feel good and strong. Can you reach up and grab my fingers and squeeze? Okay, she's got good equal hand grasps. Can you put your arms out in front of you? Close your eyes. Okay, pronator drift is within normal. She's not dropping her arm. You can put your arm down, close your eyes. Open your eyes. Put your arms down and open your eyes. You got to remember to tell them to undo it. I might check some range of motion. So you lift your arm, move it around. Okay, that feels nice. Good. There's no popping or cracking in your joints. Anything when we do that? No? Okay, good. So her upper body is good. I'm going to come down here to her feet now and have her push on the gas pedal for me. Great. Pull up. Good. Okay, why don't you go ahead and try and lift your legs against my resistance. Okay, so she's got good strength in those legs evenly. The muscles, again, I'm kind of looking at them. There's nothing flaccid or wasted or over enlarged or twitching or do anything strange like that. I'm going to just check the range of motion. Is there any pain when I do any of that? And I'm feeling the joints while I'm doing that. Her knees aren't popping too much. The student I did this morning had poppy knees. Okay, so everything looks good with her lower extremities. And then the step that gets missed a lot, again, is that sensory assessment. So at this point, I'm just going to have you close your eyes, and I'm going to touch you in some spots, and you tell me where you feel the pressure, okay?
Left arm.
Okay?
Right arm.
Whereabouts on your arm?
Forearm.
Okay, all right.
Right calf.
Okay?
Left hip.
Okay?
Left thigh. Right thigh.
Okay?
Right toe.
Okay?
Left hip.
Okay. So if you're concerned that they might have some issues, neuropathy or something, you might go into a more thorough assessment of her toes or her fingers. And now I'm going to go ahead and go into my coordination and my gait and those things. So what I'm going to have you do for me, Mandy, right, is swing out around over here to the side of the bed. While she's doing this, I'm still observing, right? I'm still looking that her posture is even and those kind of things. So I'm going to have you do a little coordination test for me and just do patty cake on your lap for me. Fast as you can. Okay, good. All right. Now touch your thumb to each finger, back and forth, again, as fast as you can. Very good. Okay. Now I'm going to hold my finger up, and you're going to touch your nose and reach up and touch my finger wherever it's at, okay? Okay. There. That's good. Show that she can follow, she can track, and all that. So those are my 3 little tests there. At this point, I'm going to have you stand up for me. Just put your feet close together, and I'm going to have you close your eyes. Okay? And so I'm right here next to you in case you feel dizzy or anything. Okay? Great. You can open your eyes. She passed her Romberg's test. I'm going to have you just go ahead and walk heel to toe like this, just over there towards that table for me. Okay, she's got good balance. When you turn around, just walk back towards me in your normal walking pattern. She's got a normal gait, no limping, nothing abnormal. Okay, you can get back into the bed. And at this point, I would tuck her in, give her her call light, wash my hands, document as needed. My findings would be that her cranial nerves were all intact, her vision was fine, she could hear bilaterally, there was no signs of any facial droop, that her speech was clear, that she was alert and oriented, and she knew where she was, and was awake when I came in. She wasn't sleeping or anything. She was awake, didn't need to be roused. That her general neuro assessment was within normal, that her muscles were all equal, bilateral in strength, no signs of wasting or swelling, that she had equal strength, and it was usually some places will have a scale, like a 1 to 4 or something, so her strength was pretty much at the top. She was fine. What else? That her balance was good, that her coordination was appropriate, there was no signs of dizziness. She did not have a positive Romberg's. She was negative there, so there was no falling over. And that her pronator drift, she did not show any signs of pronator drift abnormalities. So, did I miss anything? Did I pass? Okay, any questions?
Could you do the light like one more time on that side? Because I was kind of blocked by, sorry.
No problem. So basically, I'm watching both pupils when I do this, And I shine the light in her eyes. Some people put a hand up here so that the light doesn't transfer over.
Okay.
But basically, I'm just looking at both pupils and seeing that they both constrict. And you
Okay.
can have them like look over at your ear or across the room or some neutral location besides, right in your eyes.
Thank you.